Okay, these are the dictations for July 15th, 2019. The first patient is a 7-year-old, non-displaced tough fracture of the left third distal phalanx. So this is a 7-year-old female who presents to the clinic today with her mother for evaluation of a tough fracture of her left middle finger, period. The left middle finger was crushed in a door on 7/10/2019. Period. She was subsequently seen in the emergency room where a bedside nail trephination was performed. She was sent home on antibiotics, period. She's finished her antibiotics, period. She is doing well otherwise, period. An x-ray done in the emergency room showed a non-displaced tough fracture of the left third distal phalanx. She has no past medical history, surgical history, meds, or allergies. On physical exam, please add to the extremity portion that her left middle finger tip is ecchymotic and edematous, period. Evidence of previous trephination in the nail bed, period. No erythema, period. No pus, period. Tenderness, palpation at the tip of the finger, period. Good flexion and extension of the IP joints, period. Under imaging, please note the non-displaced tough fracture of the left third distal phalanx, period. The assessment and plan is a 7-year-old with a non-displaced tough fracture of the left third distal phalanx, status post-nail trephination in the ER. The plan is casting for 3 weeks, no contact sports, follow-up in 3 weeks. The next patient is a 7-year-old female with an earring back stuck in her earlobe. This is a 7-year-old female who presents to the clinic with her mother for consultation regarding a earring that is stuck in the left earlobe, period. The earring has been stuck for approximately 2 months, period. The mom is concerned that she may have had an allergic reaction to some earring metal that was used, period. She is otherwise healthy, period. She has significant pain when attempting to touch the area, period. No past medical history, surgical history, meds, or allergies. Under physical exam, please note that there is a visible earring back in the left earlobe with tenderness to palpation and surrounding erythema, period. There's no pus, period. Please place a procedure note. The procedure note should read, the patient was brought into the procedure room and laid supine on the procedure table. Let gel was placed, period. Their cold spray was used for additional anesthesia, period. Following this, the earring back was removed with a Kelly clamp without complication, period. Pressure was held to control bleeding, period. The patient tolerated the procedure well, no complications, period. Under the assessment plan, this is a 7-year-old female with an earring back stuck in the earlobe. The plan, as we discussed, the need to place another earring again within the next 2 to 3 days to avoid closure of the ear hole if desired. Next line. Bacitracin ointment twice a day. Next line, follow-up PRN. The next patient is a 10-year-old female with a foreign body in her right arm. This is a 10-year-old female who presents with her mother for evaluation of a potential foreign body in the right arm. The family was seen approximately 1 month ago by Dr. Trong. That's Troung, Dr. Trong, at which time the decision was made to wait to see if the potential foreign body would declare itself, period. She had a injury after a ceiling fan broke and glass lodged in her arm approximately a month ago, period. She had an x-ray done in Dr. Chong's office which did not show a foreign body. However, there was concern for glass that would not necessarily appear on the x-ray, period. The resulting wound was allowed to heal via secondary intention and no antibiotics were taken, period. She's here today with significant pain and swelling over the area where the suspected foreign body was, period. Given this, her mother would like the area to be excised and explored, period. She's otherwise healthy, period. No past medical history, surgical history, meds, or allergies. Under the physical exam, please add there is a approximately 2.5 by 1.5 centimeter vertical scar / hyperemic wound located on the lateral surface of the right arm, period. The mass is exquisitely tender to palpation, period. There's no erythema, period. There's no pus, period. Under procedure note, please add the patient was brought into the procedure room and laid supine on the procedure table. The area was injected with 0.5% lidocaine with epinephrine for anesthesia, period. Following this, the scar tissue and underlying mass was excised with a 15 blade in an elliptical fashion, period. No discrete foreign body was identified, period. The entire mass was removed and sent off to pathology for evaluation, period. The resulting wound could not be closed primarily, period. Therefore, extensive undermining was performed 1.5 centimeters medially and laterally to facilitate closure without tension, period. The wound was copiously irrigated with normal saline, period. The resulting wound was then closed with 4-0 monocryl and 5-0 monocryl, period. It was dressed with Dermabond and Steri-strips, period. The patient tolerated the procedure well, no complications, period. Under the assessment, this is a 10-year-old status post removal of foreign body in right arm. The plan is to follow up in 2 weeks for a wound check and for pathology results. We discuss scar care, instructions, no showering for 2 days, okay to get it wet afterward. And that's it. The next patient is a 12-year-old female with a 12-year-old male with a right hand ganglion cyst. This is a 12-year-old male who is right hand dominant, who presents with his mother today for evaluation of a right hand dorsal ganglion cyst, period. He is status post aspiration in clinic back in December of 2016, period. His mother reports that the mass returned approximately 6 months after the aspiration. However, it has not been bothersome until now, period. The x-ray done at that time showed a soft tissue mass consistent with the ganglion cyst. Period. Mom states that the mass has been increasing in size during the school year, particularly when he is involved in activities such as sports and playing instruments, period. He would like to have surgery to remove the mass, period. He's otherwise healthy. No past medical history, surgical history, meds, or allergies. Under a physical exam, please add that there is a approximately 2 by 1 centimeter mass over the dorsum of the right wrist, period. It is moderately tender to palpation, period. No erythema, no pus, period. Under the assessment plan, this is a 12-year-old with a right hand ganglion cyst recurrence. The plan is to proceed to the OR for surgery to excise the ganglion cyst. We discuss risks, benefits, and alternatives, including bleeding, infection, risk of injury of nearby structures, scarring, poor cosmesis, and recurrence, period. Follow up 2 weeks after surgery. He will need to avoid contact sports for 2 weeks, period. The next patient is a 14-year-old male with a cleft palate who is here for evaluation of obstructive sleep apnea. This is a 14-year-old male who had an isolated cleft palate, which was repaired in childhood by Dr. Stahl. That's Dr. Stahl, period. They present to clinic today. He presents to clinic today with his mother and father after evaluation by Dr. Soraya to establish care for his cleft palate, period. He has not been seen since childhood, period. He also has a history of tympanic membrane perforation and has had recurrent ear infections, period. Dr. Soraya is planning to take him for a surgery scheduled on 8/15/2019 to repair the eardrum perforations, period. His parents note that he has significant sleep apnea, period. He has had a recent sleep study which showed moderate sleep apnea, period. Pulmonology recommended a CPAP machine. However, due to his ADHD and other medical problems, he has difficulty with compliance with CPAP, period. His parents would like to know if his cleft palate is contributing perhaps to his sleep apnea, period. He is in middle school and otherwise doing well, period. Under past medical history, he has multiple medical problems, including ADHD, past surgical history, cleft palate repair, and ear tubes, medications, multiple medications. See the EPIC record. Under allergies, he's allergic to penicillin. On the physical exam, please add oral examination reveals a well-healed palatal incision with a very small oral nasal fistula located within the uvula, period. He has excellent elevation of the palate, period. He has very mild nasal speech. That is hypernasal speech. Period. His occlusion is barely class 1, period. He has a palatal expander in place as well as braces, period. Assessment plan. This is a 14-year-old status post palatoplasty with obstructive sleep apnea, period. The plan is orthodontics referral for orthognathic evaluation, as well as a review of his current orthodontic treatment, period. He is being seen by an orthodontist in the community and has not been seen by the cleft team in years, period. Next line, I do not believe that his cleft palate is a significant contributor to the sleep apnea, period. Dr. Soraya is set to perform a nasal endoscopy for further characterization of his anatomy while he's under anesthesia, period. Next line, he may have mild maxillary or mandibular hypoplasia, which is contributing, and be a candidate for orthognathic surgery when he reaches skeletal maturity, period. Next line, follow-up in 6 months. The next patient is a 3-year-old female with a forehead laceration. This is a 3-year-old female who presents to the clinic with her mother for a forehead laceration after being hit in the head with a paddle while playing ping pong, period. She was seen in the Woodlands TCH emergency room where her forehead laceration was suture repaired with fast gut on 7/4/2019, period. She's here today for a follow-up, period. The sutures are still in place, period. She's otherwise doing well, period. No complaints. She has a past medical history of obstructive sleep apnea, past surgical history of tonsils and tubes, no medications, and no allergies. On the physical exam, please add that she has a 2.5 centimeter vertical left forehead laceration, which is repaired with absorbable sutures, period. The sutures were removed without complication, period. There's some hyperemia, period. No erythema or pus, period. Under the assessment, she's a 3-year-old with a forehead laceration, status post suture repaired. The plan is sutures were removed in clinic today. Scar care instructions were provided, including lotion, sunscreen, scar massage, and silicone sheeting if desired at night. Next line, follow-up, PRN. The next patient is a 13-year-old female who's here for a pre-op appointment for otoplasty, period. It's a 13-year-old female who was previously seen with prominent ear deformity, period. She's a competitive dancer and desires a correction for her prominent ears, period. She has questions today about the recovery time, which we have told her will be 3 weeks, period. She's otherwise feeling good and prepared for surgery, period. No past medical history, surgical history, meds, or allergies. Under physical exam, please put bilateral prominent ear deformity, period. Excess concho bowl cartilage, period. The assessment of a 13-year-old female with bilateral prominent ear deformity. The plan is will proceed with otoplasty. Risk, benefits, and alternatives discussed, including bleeding, infection, poor cosmesis, recurrence, hematoma, numbness, poor scarring, and others, period. The patient agrees and wishes to proceed. That is, the patient's mother agrees and wishes to proceed. The next patient is a 12-year-old female with a nevus sebaceous. This is a 12-year-old female here today with her grandmother for evaluation of a right facial nevus sebaceous, which has been present since birth, period. They were referred by Dr. Lee of dermatology for surgical excision, period. Her grandmother is worried about cancer. That is, the potential for this to turn into cancer, period. Looking through her dermatology notes, it appears that the family has been reassured numerous times that this lesion is unlikely to become cancerous, although it may grow as she ages, period. At this time, the 12-year-old is not sure about whether she would like to have it removed, period. She is doing otherwise well, but struggling to manage her severe eczema, period. She has a past medical history of eczema, some remote concern for absence seizures, which have now resolved. Her past surgical history is none. Medications, she was previously taking lamotrigine, that's Lamotrigine, but has stopped, though she may need to take it again during the school year. She has no allergies. Her under physical exam, please place, she has a 1.5 by 2 centimeter right temple nevus sebaceous, just adjacent to her hairline, period. There's no surrounding erythema, period. It is well camouflaged when her hair is worn down, period. Under the assessment, she's a 12-year-old female with a right facial nevus sebaceous. The plan is, I recommend removal in 1 to 2 surgeries when the patient is old enough to participate in the decision, period. At this time, she does not appear to want surgery, and her family is mainly concerned about risk for cancer and not appearance issues, period. The patient has expressed interest in transferring her care for dermatology to the Woodlands campus, and we have provided them with the dermatology number. Next line, we discussed sunscreen for cancer prevention and general healthy skin habits, period. Follow up when desiring surgery. The next patient is a 17-year-old female who's here for a post-operative visit. There's no need to place any past medical, surgical meds or allergies. She is status post of right breast reduction and left fat grafting for Poland syndrome. Period. She was last seen in clinic on 7/2/2019. She has continued with Surgical bra and the compression garment. Period. She's had no postoperative issues. Period. She has had a significant reduction in swelling on the right breast since her previous visit. Period. She's been adhering to the no heavy lifting or lifting arms directions. Period. Under physical exam, you can put increased acne breakout on the face and chest. Period. Otherwise well-healed right breast incisions and good take of the fat grafting on the left. Period. There is improved symmetry now that the right breast has reduced in swelling. Period. The assessment and plan is 17-year-old status post breast reduction and fat grafting. She's doing well. She's okay to wear a to switch the Surgical bra for a sports bra and to wear Spanx instead of the compression garment. She's okay to shower regularly. We have asked her to limit processed foods to see if this will improve her significant acne breakout. No contact sports. Follow up in 1 to 2 months. The next patient is a 12-year-old male with a neck nevus. This is a 12-year-old male who is here today with his mother and siblings for evaluation of a neck nevus, which has been present since birth, period. It has recently been growing, period. His mother would like to have it removed, period. He has no significant past medical history, surgical history, meds, or allergies. Please add a procedure note. The patient was brought into the procedure room and laid supine on the procedure table. The area was anesthetized with LET gel and cold spray, period. Further anesthesia was obtained with 0.5% lidocaine with epinephrine. Period. Once sufficient time had passed, the area was excised with a sharp scissors, irrigated copiously with normal saline, and repaired with 5-0 plain gut suture, period. The patient tolerated the procedure well, no complications, period. It was dressed with steri-strips, period. The assessment and plan, this is a 12-year-old male who had a neck nevus, now status post excision. The plan is to follow up in 2 weeks for pathology results. Next line, we discuss scar care. The next patient is a 12-year-old female, here for a pre-op appointment for wound debridement on the right foot. This is a 12-year-old female who has been previously seen in our clinic with a chronic pressure ulcer of the right foot. She has been undergoing antibiotics for the past several weeks, and there has been a slight improvement in the wound. However, at this time, the family would like to proceed with an operative debridement and bone biopsy, period. They were last seen in clinic on 6/18/2019 and have continued to do dressing changes and pressure offloading, period. The family went to Disney World and was able to use a scooter, which the mom believes has contributed to pressure offloading and therefore improvement in the wound, period. She's otherwise doing well. She has a past medical history of spina bifida, past surgical history, none. Meds, none. Allergies, none. Under physical exam, please put there is an approximately 1.5 by 1.5 circular pressure ulcer over the lateral aspect of the right foot. period. There is abundant granulation tissue and some fibrinous exudate, period. There is no surrounding erythema, period. No pus, period. Under the assessment, 12-year-old female with a chronic right foot wound, here for pre-op. The plan is to proceed to the OR for debridement and bone biopsy, period. We have discussed with the patient our plan to admit her postoperatively and perhaps place a vacuum dressing on the wound, period. We will then await culture results and adjust her antibiotics while she's an inpatient, period. If the culture results are negative and she shows progress with dressing changes, we can consider closure of the foot wound and subsequent vac therapy, period. She may need to stay on bed rest for 3 to 4 weeks to allow closure and appropriate healing, period. This may be done as an inpatient or perhaps in a rehab facility, period. Some of it may be done at home as well, period. The patient is highly motivated to have her wound closed prior to school, and therefore we will proceed with an operative debridement, period. And that's the last patient. The 2 breast reductions did not show up, so we do not have dictations for them as indicated by the X's on the document. Thanks.